Thank you. Good morning, ladies and gentlemen. Thank you for joining us today for this EU Pavilion side event on Keep Cool in the Heat. My name is James Krzyk from the WHO European Centre for Environment and Health, and I will be your moderator for today. We have a very good lineup for you. Just a couple of housekeeping notes. For those of you on site, this is a hybrid event. We have online participants and we also have 2 online speakers so that you're able to hear them when you're sat in the audience. If you would please wear a headset. As you can also hear, there's another side event happening just on the other side. It's also so that we are able to share this space. With that, I would like to kick off. The first session is discussing why does health matter and why do we need to step up policy and action. And I'm delighted to introduce our first speaker, Dr. Chris Fern, Deputy Prime Minister and Minister of Health of Malta. Dr. Fern, if I can pass over to you.
Good morning. Good morning. And thank you for the invite. We heard Dr. Tedros this morning. The climate crisis is a health crisis. And those of you who follow the Lancet, barely 2 weeks ago, the 2023 Lancet Countdown report showed this very clearly. Over the last 25 years, the number of heat wave days in Europe and in the Northern Hemisphere have doubled. So over the last 25 years, heat wave days in Europe have doubled. And this has brought an increase in health-related deaths, especially in people over 65 years, which have increased by almost 100%, by 85% over a period of about 2 to 3 decades. So the climate crisis is a health crisis, and it is happening now. In fact, if we're honest with ourselves, we're probably a bit late in the day. But we're talking about health now, and it's an extremely important thing. There's absolutely no doubt therefore that climate change or the climate crisis has a direct impact on the health of our citizens. If you look at the number of excess deaths that we had this summer in Europe, with just 2 weeks of severe heat wave in July, it's estimated to be around 70,000 excess deaths in Europe alone from 2 weeks of heat wave. And this will, of course, get worse, and we're anticipating a bad summer again in a few months' time. And, of course, the heat crisis is not only affecting directly the health of our citizens, as we were showing, but it's also affecting the capacities of our healthcare systems to cope. Last summer in Malta, in the 2 weeks of extreme heat wave that happened on the island, we had days when we had twice the amount of ambulance calls that we normally have during summer. So the ambulance calls actually doubled over a period of 2 or 3 days towards the end of the 2 weeks of the heat wave. And the casualty attendance, the A&E attendance, increased by 3 times. So imagine you have a busy casualty department, which is always busy, always with people waiting, and the amount of people coming into casualty from one day to the next triple. And this actually happened. It happened over a small period of 3 or 4 days in July of this year, and hospital admissions doubled. In 1 week, hospital admissions doubled, especially ITU beds. We had basically all ITU beds full in a period when it's usually quiet, because summer is usually quiet. We usually have bad hospital occupancy in winter. So the climate change is happening. The climate change crisis is happening. Health crisis, as a consequence of this, is happening. It's affecting directly our citizens, and it's affecting directly the capacity of our healthcare systems to cope. And of course, we're seeing, and we will continue to see, changing patterns in vector-borne infections as the temperatures become almost tropical, especially in southern Europe, and this is something which is also happening. So yes, we agree the climate crisis is a health crisis, and which means that in the organization of remits that different ministries have within our respective governments, climate change must not remain solely within the remit of the environmental minister. Traditionally, that's where it's been. The environment minister has the climate change remit. It is now obviously also within the remit of health ministers. So as health ministers, we need to step up to this. We need to recognize that this is a real current health threat, and we just can't be on the sideline and say this belongs to someone else. Let someone else worry about it. We need to worry about it, and we need to do something about it. Last week, Malta presented a non-paper at the European Health Ministers' Council on health and climate change, and it had the support of 23 other member states. So, for the first time, and incredibly, it's only for the first time, the European Union Health Ministers' Council last Thursday debated the health effects of climate change. And we are calling on ourselves, on the Council and the Commission and the ECDC, to analyze the effect of the climate crisis on the health of our citizens and on the effect on our healthcare systems. We are also looking to step up coordinated surveillance between member states, again coordinated by ECDC, and with the involvement of HERA, because the new vector-borne diseases coming into Europe are a new cross-border threat. So we are also looking to step up surveillance on a European level. And then we are asking, again HERA and the ECDC, to step up preparedness on medical countermeasures. So the need for new vaccines as new diseases come into Europe, new infectious diseases come into Europe, new diagnostics, and of course training of our healthcare professionals, because they will be seeing not only consequences of extreme heat, which of course have direct effects on the health of our citizens, but also new vector-borne infectious diseases. So yes, the climate crisis is a health crisis. It goes beyond this because, of course, we heard there's pollution, we heard there's effects on mental health, the effects on the dwindling workforce, overworked workforce that we have, so more increased need for healthcare workers. So I would say the climate crisis is a health crisis on steroids, and we really need to step up and do something about it. So thank you very much.
Thank you very much, Dr. Fern, for opening the scene and putting heat and climate as the health crisis. I would now like to pass on to Dr. Thomas Steffen. He is State Secretary of the Ministry of Health of Germany. Dr. Steffen.
Distinguished colleagues, dear guests, many thanks for the invitation to speak to you today in this very important event. And we just discussed, the Minister and myself, that the best way forward is simply that I will agree with each and everything that he just said. And I will. And that is why I can be quite brief. But let me a little bit dive into, let's say, the correlation that he just alluded to between heat and health, and why it is a very, very concrete threat to health, not only in Europe, all over the world. I think we all know that a major risk factor is, for example, the risk factor for the cardiovascular system, and heat can lead to life-threatening illness such as heat exhaustion, heat cramps, heat stroke, or dehydration. The heat effects triggered by heat can also lead to psychological stress, anxiety, trauma, and depression. According to the WHO, the risk of premature birth increases by 16% due to heat. These are very, very precise figures that we have to discuss further. Especially the most vulnerable among us are most affected: children and pregnant women, the elderly, and people with bad health preconditions. For example, according to the German data, more than 80%, and I will repeat, 80% of all who died in association with heat this summer were 75 years and older. We must do better to protect our people, and again it reminds me of what we had to do in the last years during the corona crisis to really protect the people, and especially the most vulnerable members of our societies. In my opinion, the key to successful heat health protection is to combine strengthening the capabilities of heat health adopted behavior of all people, putting suitable and ambitious adaptation measures in place, organize joint actions by all stakeholders, and ultimately through committed climate protection. Because climate protection indeed is health protection. In the last year's Germany's G7 presidency, we have put great emphasis on the climate and health nexus. Climate and health were highlighted prominently on the G7 health agenda and in the final health ministers' communiqué, as maybe some of you might remember, and based on the commitment formulated during the COP26 in Glasgow. This afternoon, we are going to endorse a declaration which will encourage many states to implement corresponding measures in their countries. Germany is a strong supporter of this initiative. Only together we can keep cool in the heat. I'm very convinced about that. And I'm proud to mention that the outstanding work of the WHO and also by our French colleagues in the field of heat health protection provided us evident guidelines for what we put into action also in Germany, in my country. Just a couple of weeks ago, the cooperation between the WHO Europe and the German Ministry of Health was even more intensified when Minister of Health Professor Lauterbach and the Regional Director Hans Kluge met at the WHO European Centre for Environment and Health in Bonn. But climate change and a dramatically warming planet is not just heat health protection. Climate change is confronting us with conditions that we have never experienced before. Prolonged periods of heat, new pathogens, as the Minister just referred to, wildfires, floodings lead to increased health risks for everyone on this planet. We don't have much time left to build up climate-resilient healthcare systems and to complete a green urban renewal, just to mention only two ambitious long-term adaptation measures. Climate change is damaging our health, and we should be very aware of that. There is an immediate pressure to act. I would therefore like to clear the stage for the following discussion now, and I wish today's excellent panel a fruitful exchange and new and inspiring insights for the audience on how to keep cool in the heat. Thank you.
Thank you, Dr. Steffen. It's wonderful to begin with complete agreement. I hope that continues. I would now like to pass on to Diana Concha. She is Director for International Affairs and Climate Finance at the DG Klima, the Directorate General for Climate Action. Over to you. Thank you.
Thank you very much, and good morning, everybody, and welcome to the European Union Pavilion. It's a pleasure to have this high-level panel, these distinguished guests, and also I'm honored actually to be invited as a representative of the climate policy side as well as of the EU to speak in this first ever UNFCCC Health Day, the first Health Day at COP, which shows indeed how important the issue it has become and the fact that finally it has got the attention that it deserves among also the climate policy practitioners. So I won't delve on the fact that the climate crisis is a health crisis. It has been said very well by the previous speakers, with whom, of course, I also wholeheartedly agree. And I will focus on the synergies between climate policy and health policy, and on what the European Union is doing to tackle it. And I will be setting the scene for the next panel, where there will be one of my colleagues, the expert of climate and health, that will speak and will delve more into the points that I am sketching in my intervention. So. Yes, it is very urgent to act, but I think there is a silver lining in the interconnection of the two crises. Because if the climate crisis is a health crisis, it also means that an ambitious climate policy is also an effective climate policy. And that's the aspect that I'm going to look at in my intervention. The climate crisis is making us aware of the extraordinary potential of policies that can contribute simultaneously to climate mitigation, to climate adaptation, and to public health. So let's look, first of all, at mitigation, that for all of us climate policy makers is the centerpiece and the aspect that received most attention, the 1.5 degrees, the energy transition, and all that. We know that we must cut our greenhouse gas emissions deep and fast in line with the Paris Agreement if we want to keep our planet's temperature at manageable levels. And this is the EU's top priority, and we express it with a very ambitious commitment to reduce our greenhouse gas emissions by 55% by 2030, to become climate neutral by 2050, and by having the European climate law that binds us to these targets. And we are already looking now at our targets, the intermediate one for 2040, which is also going to be very ambitious. And these policies will deliver significant benefits for our health and our health system. In the longer term, it will help the mitigation, climate mitigation will help prevent the most dramatic and deadliest global warming scenarios. In the near term, it will prevent hundreds of thousands of people from getting sick or dying prematurely from polluted air. A new European Environment Agency Air Quality Health Assessment says that over 250,000 deaths could have been avoided if fine particulate matter concentrations in the EU had met WHO recommendations. This is a quite impressive number. But this is for mitigation where, as I said, which is at the center of all our effort, because in the longer term, only mitigation can save us from the worst effects. But in the meantime, we will also have to act to get prepared for the climate change impacts and risks that unfortunately are now inevitable and are growing every day, and with any decimal point of degree that the temperature is increasing. And this is climate adaptation. In the European Union, and since 2021, continuous progress in climate adaptation is mandatory for the Union institution and member states under, again, the European climate law. Also, adaptation policies shall focus, among other things, on the most vulnerable and impacted population. We will very soon publish our first official assessment of the progress of the European Union member states with regards to these requirements. And what I can already share with you is that, based on the reports from the member states that we have already received, health is considered the sector most exposed to climate risks, most exposed, and that there is an almost universal and growing concern about heat waves. As far as the Commission is concerned, we published in 2021 our new EU strategy on adaptation to climate change, and at the same time, already one of its first core deliverables, which is the European Climate and Health Observatory. So health was already in 2021 at the center of the European Union adaptation policy. We are grateful to WHO Europe, the European Environment Agency, and many other partners for working with us on this unique and very timely initiative. We have also launched, under our Research and Innovation Framework Program Horizon Europe, our mission on adaptation, which aims to help at least 150 European regions and cities to get prepared for climate change, including the health risks that come from it. finally, and I'm coming now to the next steps of coming developments, in spring 2024, we will publish together with the European Environment Agency the first ever EU climate risk assessment. The main goal of this risk assessment is to identify the major systemic risks linked to accelerating climate change, which could undermine core objectives and values of the European Union. So this is really something very big that is coming. It's also, I don't want to abuse of the term, but it's a historic step for the European Union to have such in-depth assessment and that will be there for discussion in the public domain. We work in partnership with the European Environment Agency, which carries out the risk assessment, assisted by a team of external experts in various fields, and we will also publish the technical European Union climate risk assessment report in spring next year. And I can already anticipate that health risks, including from heat, will be a very important aspect of this report, and there will be dedicated chapters on this. So we will really have the material for an informed public discussion on this issue that I think is of fundamental importance to have the scientific basis and to be able to discuss with a scientific basis. I can also announce that the Commission plans to adopt a communication with the political reaction to the finding of the risk assessment report. And the communication will probably be timed to coincide with the publication of the technical report. So we will follow up to what the risk assessment will tell us to do. So to conclude, we clearly have the duty to protect our population against the fast-growing threat of extreme heat events. We have the European climate law, we have also the global health strategy. We are fully committed to maximizing the health gains of climate mitigation and to minimizing the burden of climate change on our health and health system through effective adaptation. We have principles on what effective adaptation means, and I would like to close my intervention to quote here the 5 strategic objectives of our European and Climate and Health Observatory. First, having robust indicators to monitor heat risks, impacts, and adaptive responses. Systematically integrating adaptation to heat into national and subnational health policies and systems. Let's not forget the subnational, that's also very important. Being able to anticipate and prevent heat-related health threats in a timely manner. Having a fully heat risk-aware and trained health community. Knowing and applying the relevant evidence-based, efficient and effective solutions and public healthcare intervention. So we will continue to work with all our partners, expert agency, WHO, European Environment Agency, guided by these important issues, these important guidelines, and guided by the results of our risk assessment and technical report. So a lot of work in the future, but I think we have all the elements from the point of view of policy and from the point of view of science to put in place effective policies, especially in the domain of climate adaptation and health. And let's hope that this COP will deliver the ambitious outcome on climate mitigation that we expect, because let's remember this is a global threat, so the ambition of the European Union will not be enough to save us from the devastating effects of climate change if the whole world does not work together in this goal. So thank you very much for inviting me, and have a very good panel. Thanks.
Thank you very much. Indeed, it's a global threat, but as you mentioned, subnational action is going to be key, and we're going to definitely hear more about that later in this session. Now, flanked on the other side of this panel, back to WHO, and I'm delighted to introduce Rob Butler. He is the Director for Communicable Diseases and Environment at WHO Europe. Rob.
Thanks very much, James. And just to start off by saying I completely agree with all of the previous 3 speakers, and really, really welcome this renewed momentum for policies and actions to address extreme heat, to protect, of course, health and to protect equity. Heat waves this summer basically warranted the first time that WHO has ever declared a regional health emergency. This is the first health emergency in the European region that has been declared on the basis of climate change, heat, temperature. Many member states were indeed on fire this past summer. We've seen average temperatures climb double the global rate of the WHO regions. The European region has the fastest rising temperatures. We've also seen a 5-fold increase in extreme weather events. As I said, many member states on fire. I had a moment to reflect this summer because I actually drove from the west to the east of Greece with my family in the car, and my moment of reflection was driving for 1 hour along a highway and seeing nothing but scorched earth and smelling smoldering ashes for 1 hour traveling at 100 kilometers an hour. So you can, the gravitas of this situation really came home to me personally just on my summer holiday with my wife and kids this past summer. Of course, this has huge health consequences. 61,000 excess deaths in the European region in 2022, and we expect this number to increase significantly in 2023. But it's not just those health issues that we're concerned about. Deputy Prime Minister referred to the expanding distribution of vector-borne diseases, but also, of course, the exacerbation of air pollution that already claims over 500,000 European lives every year. The relationship, of course, is also evident with the threats to food and water security associated with malnutrition, associated with obesity, and as we saw yesterday, this nexus between AMR and climate change, which I believe the Deputy Prime Minister also took part in that session, is equally very, very alarming to us all. So it's time to forcibly act, and we have to forcibly act because we didn't concertedly act yesterday. We have to forcibly act today and tomorrow. The good news is that member states are putting significant pressure on WHO to integrate climate change considerations into all health policies. And this has also been evident from the 7th Ministerial Conference on Environment and Health, which took place in July in Budapest, where we saw a declaration brought forward that basically encouraged, prompted, motivated member states, and where member states of the European region committed to introducing and improving and updating their heat action plans and reducing health system emissions. And in many countries, health system emissions account for about 4 to 6%, depending on where you are in the region, but up to 7% in some countries of all emissions. So we're not talking about tweaks, we're talking about fundamental transformation here in terms of health system adaptation and mitigation. These actions plans I find these action plans, these heat health action plans, particularly interesting because they necessitate us to break down the silos. We have to work with health, with emergency services, with meteorological services, with our transport sector, with urban planning, with media, with civil society organizations. And we have to do this in order to create, of course, a healthier and more sustainable, more resilient societies of the future. So I've been really looking forward to this session, looking forward to hearing to the experiences, but most importantly, hearing of solutions that have been applied to safeguard health from heat. So, Madam Director, thank you so much for co-organizing this with us, but thank you also for the incredibly strong partnership around heat health. It is a partnership, I think, that will serve us very well in the future. I'd like to express my thanks to all of you and the member states that are joining us online, because I really feel that together we are confident that we will turn this challenge into an opportunity. We will transform evidence into action, and we absolutely have to pave the way for a more sustainable, healthier, and resilient sustainable future for all of us and, of course, the next generation. So I thank you for your attention.
Rob Butler, thank you very much. Definitely, there's a lot of ambition and we have our work cut out for us. I would like to ask everyone to give our panel here a round of applause, and thank you very much. And if you would like to take your seats on the front row. This is the science. So, sorry, can you hear me now? Right. Thank you for sticking with us. We are now moving to the next session of this side event. As they often say on side events, this is the sciencey bit. I would now like to introduce, we have two speakers for you. Our first speaker is Dr. Joy Shoemake-Guillemot. She is with the WHO-WMO Joint Office on Climate and Health based in Geneva. And Joy, you are going to talk to us now about global climate is evolving and temperature patterns are changing and leading to more frequent intense heat waves. Tell us a little bit more about what the WHO is doing and what the situation is.
Thank you, James. Is this on?
Is it on?
So thank you very much, everyone, for inviting me here today. I think the slides are not advancing. This click. Do I need to stand?
Slight technical issue with the clicker.
Oh,
there we go.
There we go. Great, thank you. So, as we've already heard, we are in unprecedented times. My colleagues at the World Meteorological Organization earlier this week released the 2023 State of the World's Climate, and this year will be the hottest year on record at 1.4 degrees above pre-industrial levels already. The problem is that we also said that last year. And we also know from the European State of the Climate that Europe is the fastest warming world region. And we're particularly seeing that warming trend occur in the southwest of Europe and the European Arctic. As we've already heard from many of you this morning, many European countries have experienced their hottest temperatures on record, which mean that their populations, communities are simply not prepared for these types of conditions. They have never seen them before. And we've also heard that along with extreme heat come fires, come other risks, because hotter, drier conditions are elevating the risks for extreme fires. And as you see here, the blue lines are the temperature trends for Europe last summer, and the red line is the burn rate of hectares lost to fire across Europe. And you can see as the temperatures rise, so do the acres lost. Change clickers, great. We've already also heard that 60,000 Europeans lost their lives, and these were all preventable deaths. Worldwide, we are concerned about extreme heat because the heat waves are also becoming more complex phenomena. They're not only lasting longer, geographically, they are much larger. The graph that we're looking at here are the number of heat wave events in the red line, but the number of those that are happening in multiple locations at the same time are the blue lines. That the events that are occurring are much more complex. And these are transboundary events, which means that you can't depend on your neighbors if you have linked energy systems, transport systems, agricultural trade systems. This is putting pressure on all of these at a transboundary level like we have never seen before, and this is happening worldwide. Looking forward, it is delusional to think that we will go back to cooler times. The IPCC summarizes that all future trajectories are going to be much hotter. And with that heat, we will expose more populations. We will see greater risks for mortality and heat illness. And this is our new reality. There is no going back because of the entropy in the climate system. The greenhouse gases that are already up there are warming the climate, and that will continue for decades to come. We are locked into this warming and future, and that is something that policymakers can plan on. There will be no surprises. We know that this is happening, and this is what we need to start to prepare for. In Europe, thanks to Copernicus, you have some of the best information to know how heat wave days are going to be increasing at the country level, as well as down to the city level across the region. This is incredibly important intelligence that the policy community needs to be very familiar with and starting to understand how to integrate across policies and government. The positive note here is that we can predict heat. There are no surprises. We know this is the trend line that we are now living on. And there are tailored heat wave warning systems in most countries across the European Union. And that is fantastic news. But at the same time, if we could predict this, why did we lose 60,000 Europeans last summer? Why is that happening? Thanks to initiatives like Early Warnings for All, the WMO and other partners are going to be working with member states to scale up the availability of warning systems and getting them to the last mile. I lead a network called the Global Heat Health Information Network. It is a community of practice working with public health agencies, meteorological agencies, NGOs, other parts of government from all around the world. And we've been having conversations with how do we better use these predictive capabilities, these early warning systems that we have. And the challenges come not in predicting the temperatures, predicting that onset, how severe it's going to be. That's not the complicated part. The complicated part is getting it into communities, helping them understand that every person is vulnerable. Each one of us in this room is vulnerable to heat stress. How do we communicate that better? How do we start working across government with different sectors to manage these multi-hazards of fire, of water stress, of heat that all come together as a package? It's not just heat stress cases that are coming into the emergency rooms. We're also seeing at the same time the pressures from these other hazards that heat is triggering. So harnessing this information is going to take a multifaceted approach. We have to attack this problem from all angles. It is not just a health issue. It is not just a climate impact or climate adaptation policy issue, but it is a labor policy issue. It is a water policy issue. It is transport. It is health. And we have to find ways to work together to address these issues, from emergency situations that happen every summer to these long-term trends. We have to start adapting our policy to these new realities. And so, as already mentioned, heat action plans are a really great place to start in doing this, because it brings everybody around the table to understand the interests, to understand the opportunities, to work together across sectors, as we've already heard from Rob. And tailoring this meteorological information to meet the decision needs of policymakers in all of these sectors, getting these impact-based forecasts and warnings. That's what the meteorological community is ready to engage with. But the meteorological community need to have these partnerships to know what the decision needs are. How can they best tailor this information to work with you? So just as a recap, heat really is an all-of-society problem. It is now, it is in the future. It involves people, it involves the infrastructure and technology that we rely upon, and it relies upon the environment that is so critical as a health determinant. Because all of these deaths are preventable. We have the knowledge of how to prevent these deaths. There are opportunities through policy, through community engagement, to save lives from heat in the future. So thank you very much.
Thank you, Joy. I love your point on communicating vulnerability. As a communications officer, that's something very close to my heart. Indeed, very difficult. Our next speaker is Alexandra Kazmierczak from the European Environment Agency, and we would love to hear a little bit more of the impacts of heat and what that is going to be in Europe, the impact on health and health systems. So over to you, Alexandra.
Thank you very much, and good afternoon, dear colleagues. After so many excellent interventions, I'm not quite sure if I can really add so much, but maybe I can add a new angle to this story that is unfolding in front of us. Could I please have the slides? Just to maybe fill in the silence, I am working at the European Environment Agency, and one of the initiatives we are engaged with is the European Climate and Health Observatory that was already mentioned, which is the initiative of the European Commission and other organizations. So a lot of the content I will present comes from this initiative. As it has been said already, Europe is getting hotter. We can see that the average temperatures over the last summers have been going up. 2022 was a record year, with 2021 and 2023 not far behind. And of course, this only shows part of the story. What is really interesting is the extremes that we are facing, and it's getting worse. We might be expecting in Europe regularly temperatures over 45 degrees Celsius in parts of Europe, even going as far as 50 degrees Celsius. But what we also see in parallel is the vulnerability of our society is increasing. Our society is aging. More and more people are living in cities. We have prevalence of diseases, cardiovascular diseases, respiratory diseases, diabetes, all that makes the population more vulnerable to the health impacts. So we have this perfect storm brewing of increasing heat, increasing vulnerability, and we need to respond to that. And the sad part is that the heat kills the most vulnerable people in our society. Please forgive the mistake on the slide. It refers to summer of 2022. We don't have the numbers for 2023 as yet, but the story is the same. It's the elderly, it's the people with pre-existing health conditions, it's the infants, but it's also the people working in highly exposed jobs in construction, in agriculture, forestry, mining that are the most affected. And indeed, heat has substantial impacts on our health systems and on our economy. What we see is that then health systems are not impacted only through the demand for patient care during heat waves, but also really directly. Nearly half of European hospitals in European cities is located within a strong urban heat island effect, which really exacerbates the impacts on the patients. It exacerbates the demand for cooling, for example, as well. We can also see that the workers working in highly exposed occupations, they need to take more frequent breaks, and that reduces the productivity. On average, 16 hours per worker in highly exposed occupations like construction, mining, agriculture, forestry are lost every year. It's not equally distributed across Europe, and the losses are the highest in the south. The risks of heat to health are already recognized in policy, and according to the country reporting under the governance regulation on energy union and climate action, heat is the most impacted sector by climate change. And most of the European member states do recognize that the hazard of heat waves is increasing and will get worse in the future. To reiterate the point, to address that, we need a concerted action across various sectors, engaging multiple actors. We need to ensure that then heat warnings are in place, but they also are picked up. Community awareness is absolutely key. And for example, the WHO Europe Keep Cool in the Heat campaign is one of the examples how this awareness can be raised. We need to change the way how we plan and design our cities. They need to be keeping us cool through greening, through sustainable building design. We need to adjust the working patterns, not exposing people to excessive heat. And one maybe aspect to mention is then solidarity, is making sure that the society is looking after the most vulnerable, that people in the community are taking care of those who are around them and might need help during the heat waves. At the European Environment Agency, through the European Climate and Health Observatory, we are collecting examples of measures. And for example, WHO Europe are working on the next iteration of guidelines on heat health action plans. We also have some examples of these heat health action plans being implemented at national or subnational level. We have examples of greening that is happening around vulnerable locations such as schools and hospitals in various European cities, but also the adjustment of practices, for example, in agriculture in the south of Europe. So I would like to warmly encourage all of you to have a look at our portal, the European Climate and Health Observatory, to see the excellent work of our partners and see the examples of policies, of solutions that can be adopted to protect our society from heat. Thank you very much.
Thank you, Alexandra. Hammering it home, the heat is directly impacting hospitals, not just through patient and hospital emissions. So really bringing that down nicely to what our next session will be, looking at national and subnational action. But a round of applause for our two participants. Thank you very much. They loved it on the other side. Short change, thank you. And now we start with the last session of this side event. We have heard the political ambition and the policy mandates. We have heard about the science of the impact that heat is having. So now let's look at what we can do about it. We, in this panel, will be starting at the local level, where a lot of that action takes place, and moving up through to the European level and looking and analyzing what is being done and what can be done at the different levels. I am delighted to introduce our first speaker, starting at the municipal level, at the city. I have Sharon Dijksma, who is mayor of the city of Utrecht in the Netherlands. And Sharon, I would love to hear what is happening in Utrecht.
Yes. Does it work? Yes, it does. Good afternoon, everybody. I think that I need to explain a little bit about Utrecht. Some of you will know it, especially the people of WHO, since we recently had a big congress together in my city. Utrecht is the fourth largest city in the Netherlands, approximately up to, in a few years, 400,000 inhabitants. And I think it is, at one hand, a very old city. We were already there in the Roman era. Then it was called Trajectum. And at the same time, since we are one of the oldest cities in the Netherlands, we are also one of the youngest cities in the Netherlands. So we have a lot of young people living with us. And we are the fastest growing city in our nation. So, and that is actually challenging, because at one hand, the city is well organized, many people live a great life, and at the same time, we still have also huge groups of people who find it hard to live their lives as they wanted to. They are facing poverty, for instance. They are facing health problems, which most of the times is one side of the same coin. And so we need to really work on this. And what we do, because heat is absolutely an issue in the Netherlands. Flooding is also an issue, I have to say. But we have an integrated heat action plan. And what we have heard from you, it is really necessary to overlook this from all kinds of perspectives. So not only how you build your city and how you green it, but also on the social challenging. So we have, for instance, a network within our city of people who work with us or for us, who, when a heat wave is coming up, try to be in contact with those who are the most vulnerable, to keep an eye on them, to give them the advices that we saw here: keep your body cool, drain, hydrate, etc. So at one hand, we build back nature in the city. So we try to, even though we are growing, having much more green spaces than we had. And we encourage also our citizens to do so. So we have, for instance, this sounds a little bit strange, but it is a tile whipping plan. So if you have a street and your house and the wall of your house is on the street, you are allowed to get rid of some tiles in front of your house and then build plants, for instance, in it. So that we get out the tiles and get more green in the street. That is an example. We have the high road in the city, we got rid of it and we built back a canal where people can recreate. So we are not only building back green, but also blue. So these are some of the examples that we are doing, an integrated plan, both on how you build your city, both on social aspects, and on thirdly, also making people conscious that this is what is necessary.
That's wonderful, putting that right down to the city level and what can be done. And it reflects also what Director Concha mentioned this morning, that a lot of those actions are happening at the local level. Thank you very much, Ms. Dijksma. We are now going to, yes, sorry, round of applause. Thank you. I'm so anxious to get on and hear what we have. Slight technical problem with the next speaker, so we're going to move on and we'll come back. But we were going to interlude on looking at regional level, but we're going to jump one and now move to national. And I am happy to introduce Sergio Iavicoli, who is the director of the Directorate General for Communication and European International Relations at the Italian Ministry of Health. Dr. Iavicoli, I would love to hear what's being done in Italy.
Okay, thank you. And I have a slide in the meantime that they load it. Let me recall some of the speakers before. So I will talk about our national adaptation plan that is running since 2018. And now we start seeing, as I will show, some promising results. I know also that it's planned also one of our regional people that is involved in the program, so that we can see what we are doing. The motivation, of course, I won't recall. I mean, Dr. Stefan before was clearly showing the motivation and also the impact. Why Italy? Also because of its geographical position was affected by those data that the colleague from the European Environmental Agency showed last year. National Medicine showed that more than 61,000 people lost their lives because of heat waves, and Italy was one of the most affected in 2022. So what we see, basically, we have three pillars. The first one is the meteorological authority system. It's also our information system, and is involving also municipalities and regional authority. That is engagement at all levels. It's very important. We develop easy alert code, which is in three colors. So it's green on level, medium level yellow, and red level. So the alert goes on different way, goes to news, goes on major newspaper, all the channels are involved, and it's covered 27 cities. It goes from May 15 to September 15. The second pillar, which is the one we were following centrally, and this year was very strongly implemented with testimonial. We also alerted a toll-free number. We engage also health professional communities to implement what we call Let's Protect from Heat, 10 simple rules, and particularly targeted to elderly and vulnerable population. I mean, this campaign, we invested a lot on this, and I think the adaptation is start showing some result. In the last pillar, the epidemiological surveillance, which is once also producing it's also producing some results. You can see in this epidemiological surveillance that we have a daily mortality surveillance system, which is done by the regional epidemiological center of Lazio. But I think the good news is that the new data that they are released now for the first time are showing that we have a dramatic decrease in mortality compared to the last year. While the percentage was increasing last year, as you see, was 15%, this year we came back to the 2018 5-year period that was taken as a term of reference. So we still have an excess more in the south, but even it's a decrease to those data for the north. So the average, there is no significant decrease to that. Of course, these are data that needs much more data, analysis and secondary analysis, but I think the investment in policy, in communication, in promoting adaptation, I think are encouraging in this sense.
Thank you very much. We thank Ms. Dijksma. Unfortunately, another engagement, as we can understand, but thank you very much for your participation. Thank you. We will now jump to a virtual participant. We have online Sébastien Denis. He is the director of the Environment and Occupational Health Division at Santé Publique France. And again, Sébastien, could you give us an idea at the national level in France what is happening?
Thank you, James. And first of all, I would like to thank the organizers for the opportunity to speak to this high-level panel and also give an overview of the French action regarding heat and health. So, as it was mentioned, in the context of climate change, heat waves are one of the major environmental threats for the French population as well. From 2015, they are more intense and occur also sooner or later in the season. And for instance, we had this week, during the second week of September, an 8 days heat wave episode. So that's really noticeable. Santé Publique France has also recently estimated that the burden of heat in France between 2014 and 2022 was 33,000 deaths, and most of these deaths were people over 75, but still that around 20% occurred for people below this age. So in this context, France has elaborated an intersectoral heat action plan to prevent the health impacts of heat waves. This plan is under the leadership of the Ministry of Health, but also involves other ministers that are impacted, and so overcomes the silos. It's the example of Ministers of Interior, Environment, Labor, and Education, etc. This plan provides very concrete solutions to policymakers at the different geographical levels, from local to national, to protect people and infrastructures from heat. The plan is activating for each continental French department from the 1st of June to the 15th of September. Actions from this plan are implementing according to an early warning system elaborated by Météo France, which is the meteorological agency, and Santé Publique France, that's the National Public Health Agency, and so it's a quite close collaboration between these two agencies. The system is based on forecasted temperatures and their predicted impact on mortality. 3 levels of alert, yellow, orange, or red, allow to gradually implement either collective or individual preventive measures to protect health of the general population and the most vulnerable ones. In terms of public health interventions, the plan combines surveillance, public awareness, and prevention measures. Regarding surveillance, different indicators of impacts are estimated and communicated to the population. During an heat wave event, a day-to-day estimation of the impact of the heat waves on mobility is done, and for each event, the excess mortality is also estimating using an European Euromomo model 10 days following the event. Then, at the end of the summer season, a global estimation of the impact of the successive heat waves is made for mobility and mortality, and since 2022, the burden of heat on mortality for the entire summer season is also estimated. Regarding public awareness and prevention, different actions are also implemented. From May, we have a communication to health professionals, providing them all the necessary resources and recommendations to protect the most vulnerable, the elderly people and the youngest. Then during the summer season, a day-to-day communication adapted to elderly people beyond 65 years old in healthcare centers and pharmacies. And then during a specific heat wave event, specific communication on social networks, targeting elderly people, pregnant women, and parents of young children and general population from 18 to 65. And then, in addition to these specific actions focused on heat waves, France has also a national adaptation plan that enlarges the action to protect health in the context of the major health threat that constitutes the climate change. And thanks for your attention.
Thank you very much for joining us, Sebastian. And we've now had two examples of looking at what can be done at the national level. We're now going to come up and we're going to have a couple of examples of what's happening at European level. Our next speaker is Rosalinda van der Vlies. She is Clean Planet Director, I think that's a wonderful title, from the Directorate General for Research and Innovation. We're delighted to hear what is happening in the research and innovation framework of the EU to combat health impacts of heat.
Yeah, thanks a lot, and it's a real pleasure to be here. And I think it's also, you know, in the wonderful climate here in Dubai, a very important and timely discussion to have. So I will focus on the European research and innovation activities. So we have been funding and investing for many years European money for research and innovation. And so far we have been investing in more than 700 projects covering a total European financial contribution of more than 3 billion euros. But I think we can really say that in the current program for research and innovation, we have really stepped up our commitment and really prioritized even more the research that goes into addressing the health impacts of climate change. Because in the current program, which is, by the way, the biggest publicly funded program for research and innovation in the world, Horizon Europe, we have 95.5 billion euro that we are investing in research and innovation in our programming period, which runs up until 2027. But for health, we have dedicated a specific budget of 8.2 billion euros. So I think you can really see that we understand the importance and the urgency also to bring new insights and also to propose innovative approaches to address the challenges that we are facing. So we have a dedicated cluster in Horizon Europe that focuses on the health impacts. And we basically are organizing the projects that we are investing in 10 separate clusters, where we are now already launching 50 projects that are currently ongoing, and we are covering, you know, a wide range of different aspects. We focus on occupational environment, on the living environment. We focus also on the impacts of various groups. So specifically, we focus, for example, on youth or elderly people or workers, and we also focus on the physical health, the mental health, and well-being more generally. We have a specific climate health cluster, and there we have specific projects brought together that in total are funding 60 million euros, and there we look at specific issues such as the health stress, the vector-borne diseases, but also the interaction between climate change and air pollution and mitigation from the healthcare systems. I also would like to mention that we have a specific instrument under Horizon Europe, which are the so-called missions, and there we have two specific missions that are very important also for health. First of all, we are working with 100 cities in the European Union that have committed themselves to be climate neutral by 2030 already. And studies have shown that cities that do a lot of investments in climate neutral solutions are also having a positive correlation with the mental health. So, for example, if there are a lot of green spaces in the cities, that is really having a very positive impact there. And then the second mission is the adaptation mission that aims to help the regions, local authorities and cities to better understand the climate risks, also develop preparedness pathways to cope with the changing climate, and test and deploy solutions on resilience. So all in all, you can see that, you know, at the EU level, we are very committed to build the evidence base and find solutions to reduce the health impact of climate change. At international level, through mission innovation, we are collaborating at international level to build the evidence base on heating and cooling. We have a specific innovation community there. And I would like to conclude by inviting you all to a very high-level important conference that we are organizing in Brussels. It's also following up on this discussion discussions at COP. It is called Research Perspectives on Health Impact for Climate Change. It will take place on 19th and 20th of February. And this is really the opportunity to define a common strategic research innovation agenda so that we really bring together, the knowledge that has already been generated. And I think it's very important to make sure that we can build on the results of the knowledge we already have, that we don't duplicate, additional investments in research and innovation, and define a common agenda on what are the concrete and urgent knowledge gaps that we still need to address. So I hope to see you all there in February in Brussels at this conference, and we will take home the conclusions of this discussion today. Thank you very much.
Thank you very much. And thank you for the invitation. Look, that was research and innovation. An awful lot happening in Europe, and also, and it's a massively funded research and innovation framework, and I'm really glad to hear that's being put to use on heat in particular. But moving from research over to adaptation policy, Peter Löffler from DG Klima, I would like to hand over to you.
Thank you very much, James, and welcome to everybody. Adaptation policy. What I can tell you is that health, of all adaptation policy, has grown to take really increasingly a central stage of the adaptation policy its entirety, because there's this growing awareness that ultimately climate change boils down to being a risk for our well-being and for our health. And I think we got already a sense of just how complex climate impacts and heat impacts on our health are, and how many different pathways they take. And so in adaptation policy, the challenge is really to do many different things at the same time to protect us effectively against the heat threat. And so the order of the day is really teamwork. We need to work in interdisciplinary manners, across sectors, and we need to work at every level of the government. And we have heard examples already of the important local and national work that's being done. Now, we do have an EU adaptation strategy, and that refers to the local level as the bedrock of adaptation. But we wouldn't have been drawing up an EU adaptation strategy on adaptation had we thought that there's no role for the EU to play. Our adaptation strategy really serves to sort of drive three core objectives, and this is to make adaptation smarter, faster, and more systemic. I tried to give a bit of a sense of what that could mean for heat health and what we are doing under these three headings. First, smarter adaptation. Rosalinde spoke already about Horizon Europe and how sort of we undertake a research effort for better informed decision making. Then there is a lot of work on indicators, data, modeling, and monitoring, pretty much also fed by the data which are created by our Copernicus Earth observation system. And we have here sitting in the back Frédéric Acco from the Belgian research company Vito, which used this data to create urban climate information for 100 European cities with fairly high-resolution models, which can be adapted also to other cities. So this is a practical use case of that. Alexandra spoke already about the European Climate and Health Observatory. I think without a doubt this is our core initiative in the field. It's collaborative. We have many partners in it. We are very thankful for that. We do work on heat impacts, on national heat health action plans, on early warning systems. Very important are the case studies. Very many clicks on the case studies in cities, how, for example, different cities across the EU address heat health in different ways. And the observatory is now available also in 6 languages, the 6 big EU languages, which has increased its outreach. Also, we work hard to give the observatory a more operational angle and to involve and sort of have more initiatives on capacity building. And that brings me to the second theme, which is faster adaptation. We aren't given a lot of time, so we were supporting the WHO's work on heat health action planning guidance, and Oliver will say something about that. So we contribute to that financially, and we're very pleased about that. The adaptation mission has been mentioned by Rosalind as a driver of local adaptation. Peer-to-peer knowledge exchanges between cities, totally important. You know, if one mayor does it, it's meaningful for the other. We have the Covenant of Mayors. We've got the case studies in the European Climate and Health Observatory. Our cohesion policy offers city-to-city exchanges, which I just learned are underused. But this is a tool of cities to see what other cities do on heat health. And finally, our new ASFA partner, ASFA, the European Public Health Education Schools, is engaging in an initiative on training and education of the health workforce in particular, which I think something is what the Council also just asked us to do. Finally, a more systemic adaptation. As I said, it's a teamwork. We need to work across sectors. So we have work on air pollution, because air pollution and heat combine to mortality squared. We have important work on buildings regulations. Europeans spend 80 to 90% of their time in buildings. Buildings, depending on how they are, can protect or do not protect you against the heat. So there is the EU regulatory framework on buildings, EU-level guidance on the climate resilience of buildings, the renovation wave, where we try to increase the renovation of buildings and all that. Important work on nature restoration and urban greening to sort of cool down cities. An increasing amount of work on labor, occupational health and safety. EU OSHA provided heat, guidance on heat at work. And finally, our colleagues from civil protection are now running a scenario building exercise under the Union Civil Protection Mechanism, once again to see how heat impacts many different sectors, but certainly also our health. Thank you, and I hope this was a useful overview.
Thank you, Peter. Definitely useful, definitely interesting to hear what's happening at the European level. We're now going to take it one level higher. As our last speaker today, we have Oliver Schmoll. He is Program Manager for Water and Climate at the WHO Regional Office for Europe. Oliver, at the European regional level for WHO.
Thank you very much, James. I see that I have -5 seconds for my statement on the timer here in front of me, and I hope that you can hear me. My voice is a bit weak today. Can you hear me? Okay. I see some supporting signals. Okay, so being the last speaker, it's easy to start with, I agree with everything to continue the tradition of the opening panel. I think the discussion has been extremely rich. I think the conclusion is heat is becoming more frequent and more intense. We see significant morbidity and mortality coming out of heat that requires our attention. It's not only the death, not only the mortality, but also the day-to-day suffering of the vulnerable population groups that has been mentioned. I have been witnessing that myself with an old and sick father who had really been suffering with the hot summer and where he wasn't able actually to leave home because of the heat. So it's also becoming quite a very personal and very direct issue for many people around the world. The good news is that the adverse effect of heat of heat on health are largely preventable. We have very clear evidence for this. If we take very clear public health action which is manifested in heat health action plans, and several of you have already elaborated on heat health action planning. We know from our evidence review that we undertook in our office just recently that in countries where you have functional and effective heat health action plans in place, you can actually reduce morbidity and mortality related to heat. And we also heard examples from France and from Italy this morning, which is providing evidence for that. Across the region, the European region, which goes beyond the European Union countries, we estimate, without having a very clear picture, but we estimate that between 20 and 25 countries have systematic heat health action plans in place that applies to both national and local levels. You will be surprised to hear that the first edition of WHO's heat health action planning guidance, which was at the time jointly issued by the European Commission and WHO, has aged. It is already 15 years old. It is a bit time now to look into a second edition. But again, the good news is that we are on a process at the moment by systematically reviewing not only the evidence that is related to the effects of heat on health, but we are also looking systematically into the evidence that relates to the effectiveness of implementation of the heat health action planning core elements and drawing our lessons from that to update the document towards a second edition. Let me pick two figures, two emphasis that we take in the updating process, both of which had been mentioned already in the discussion earlier in the session. First one, communication. Communication and communication. Several speakers has elaborated on that. We will need to reach vulnerable groups, of course also the general population, but particularly vulnerable groups, reaching them and to provide them with advice and support in how they can protect themselves to not suffer from excessive heat. And we have been finding out from our analysis of existing heat health action plans that communication actually has been one of the weakest elements in the existing heat health action plans, and therefore we put due emphasis on improving the guidance and the advice on how communication plans at the country level and at the local level may look like, building on the best practices available. Secondly, the second emphasis that had also been mentioned previously is urban planning. Urban planning is an issue which is super important, not to prevent the effects here and now and today, but also to transform cities and urban areas into places that are cooler, to prevent the heat island effects, particularly in urban areas. So that is a hard one and has been rarely addressed in existing heat health action plans. Why? Because it requires collaboration across multiple sectors, and we are preaching that already for decades, I guess, but it's still not happening everywhere where needed. So particularly in the urban context, there is a need for collaboration between the building sector, building design, the energy sector, transport policies, all of which contributing to a smarter city, a cooler city where people can also avoid exposure to heat. So this is really what we are aiming to do. You will see that updated guidance document coming forward in 2025. Many of those represented here in the room are contributing to this process, and once more, big thanks to the European Commission also for supporting that process and developing the second edition of the European Heat Health Action Guidance. Just as on a final note, we have also been learning that even though this is a European product, if I may say so, particularly zooming into the challenges and the experiences from within the European context, the guidance, the first edition of the guidance has been used globally across all countries on all continents, and we expect that the second edition will do the same. And and we would like to warmly invite you, once we are ready, once we have to present something, we will reconvene and present to you the updated guidance, and we will be very happy to discuss with you of what is coming forward. Thank you very much.
Thank you, Oliver. As a wrap-up, I've written as a note to self, make remark that will leave speakers and audience inspired and ready to make change. That's pretty tough, and I believe unnecessary, because I hope our wonderful lineup of speakers has done that for you. So I would like to close with a final round of applause to all our speakers. Thank you very much and have a good day.